Have you been bottle feeding successfully? You think everything is going great and that you'll just practice breastfeeding when you leave hospital, but it is not working. Don't worry, you're not alone. In this video, I'm going to go through everything and give you all the tips you can use to help your baby transition back to breastfeeding after you've been exclusively pumping or bottle feeding. Welcome back to Lactation with Amy. I'm a registered nurse, midwife, and lactation consultant, and a big part of my postnatal support is to help babies and moms go back to exclusively breastfeeding after pumping, building up supply, and bottle feeding for a while. Let's dive straight into it. Why are we having difficulties latching and breastfeeding when you know that your baby can suck and swallow with a bottle just fine? There are usually two components to this. The first one is the latch. Can your baby open their mouth, latch, and form a suction on your breast? If they can do that, but they're not sustaining their latch, that comes to the second component, which is the flow. The flow of the bottle and the texture of the bottle and teat can be quite different from how your breasts feel. So, depending on the flow of your milk and your supply and the bottle you're using, some babies have difficulty transitioning back because it is a different experience for them. Because breastfeeding takes the two of you, both you and your baby need to do your part to make it work for you. First, we're going to go through what you can do. Then we're going to talk about things we can learn about baby behavior and things we can do to help baby. And then lastly, at the end of the video, we're going to put the two and two together and give you some practical and useful advice to transition baby back to your breast. So if you're interested, please keep on watching. Things you can do. Number 1, breastfeeding attempts. You have to try to latch your baby on the breast or put baby near the breast or at least give it a chance. Breastfeeding is like learning to ride a bike. If you never get on the bike, you'll never know how to ride a bike. A lot of women I see have stopped attempting baby on the breast because it just has not been working. But if your goal is to breastfeed and you're not giving baby the chance to breastfeed just because it hasn't been working, you're probably never going to achieve your goal. Even if you just do skin to skin and put baby next to your breast for 5 minutes before you give baby a bottle, that's a baby step towards reaching your goal. If you think that this has been too much and is no longer a pleasant experience for you and baby, then keep watching. We're going to talk about strategies to overcome this. Number 2, expressing. You need to express every time your baby feeds with the bottle, especially if you're still trying to establish your supply or using some formula. So the two components to breastfeeding is that your baby needs to latch to the breast, and also there needs to be somewhat of a supply for your baby to breastfeed well. The latch takes two of you and needs practicing, but the supply is more within your control. Express at least 8 times every 24 hours, either with your hand or an electric breast pump, and keep monitoring your supply. As long as you're expressing 8 times or more every day, your supply should be slowly increasing every day. If you're having problems with low supply, feel free to watch my video about expressing and low supply. Number 3, we need to read baby's behaviors and be a little bit flexible. Your baby is a mini human and they will try to communicate their needs with you through their cry and their body language. We really need to tune into these cues as it will help you pick out the best time to try to feed your baby. At first, it might seem like your baby is just crying all the time, or you might feel that your baby is arching their back so that they're rejecting your breast. But in reality, arching their back is actually a sign that they're interested in feeding. Depending on the extent of them crying, sometimes they're distressed, sometimes they just have a dirty nappy, sometimes they're just telling you they're hungry. Number 4, our mindset. Hopefully you've already established your milk supply by now, and all we need to do is piece the 2 and 2 together, aim for your baby to drink breast milk directly from your breast, then from a bottle. So while you're trying to latch your baby onto the breast, we're going to try to change our mindset and make it a little bit less about food and more about getting your baby to spend time and sucking on your breast. This is because if you have a supply and your baby can stay around your breast and suck longer, the longer they suck, eventually the more food they get. However, if you focus all your energy as soon as your baby sucks and thinking about, is my baby getting food? Is my baby swallowing? Is my baby getting food? When you're still struggling to get your baby to maintain their latch or latch all the time, we're kind of skipping many steps here to achieve the goal. So if you're wanting to breastfeed, your baby needs to open their mouth and suck. If they can do that, they need to maintain their latch and suck, pause, stay on the breast for a bit longer. If they can do that, usually they will start drinking. The breastfeeding experience will be so much more relaxed for the both of you if you can simply change your mindset and just give it your best go. And if it doesn't work, you always have the backup option to feed your baby your express breast milk. Now we're going to talk about baby behaviors because that's the component that's kind of more out of your control. And you just need to learn to cope with what your baby is telling you. It's really important for us to read your baby's cues. You cannot breastfeed a baby when they're asleep because they physically won't open their mouth. If they don't open their mouth, they can't latch. Also, you cannot breastfeed a baby when they're screaming and crying because they're too hungry or you've been trying to practice latching for too long to the point that they're hangry. In this baby cue behavior, you can see that sometimes their early cues is just a little bit of stirring in the cot when they're not necessarily showing hunger cues, but they're just less asleep than they normally are. And sometimes you might not even recognize it as a feeding cue. And early feeding cues are signs of them turning around, sticking their tongue out, putting their hand next to their mouth. And a late feeding cue is when a baby gets red in the face and starts crying. So when you're trying to feed baby during the late feeding cue, they are hangry. And that is not the best time to try to practice breastfeeding, especially if the experience has been distressing for you. When you're hungry, you just want food. You don't really care what food or how you get it. You just want to put it in your mouth, right? So a really similar thing happens with babies when they're hangry. And if you're trying to introduce a brand new experience slowly while they're hangry, you can understand how it becomes really frustrating for them. So the best thing you can do if your baby is actively crying is to offer them half the amount of their usual bottle and just give it to them like how you normally do. You can put them in the position where you want to breastfeed them and give them the bottle that way and just settle them first. After they have half the amount of their usual bottle, if they're no longer actively crying, that is the best time for you to try to latch your baby. On the other hand, if your baby is sound asleep and not interested in feeding, depending on how long it's been or whether you can give them more time to become interested, you can then change their nappy, undress them, do skin to skin, express drops of milk for them to lick and taste and smell, or you can put them in the skin to skin position, fully naked in the middle of your chest, and start seeing if they have some feeding cues. Sometimes you might need to give them half an hour of skin to skin in the middle of your chest, or even longer to see if they become interested. If your baby is not well or having weight gain problems, you probably need to start the feed. In this case, you can also start them off and give them half a bottle first to entice them and tell them, okay, we're going to have a feed now. And hopefully once they have a taste of your milk through the bottle, they can then show more feeding cues and wake up and have a go on the breast. Sometimes babies are used to the silicone texture of the bottle, and the breast can be either too soft or too firm if you're engorged, and it becomes very different for them because they're used to the texture of the bottle. In that case, you could consider using a nipple shield. A silicone nipple shield is something that you can put on top of your breast, on your nipple, and it mimics the texture of the bottle, which is probably something they're more familiar with. If you're using a nipple shield, you can also put drops of your breast milk just outside the shield so that your baby can hopefully taste your milk straight away and get the instant satisfaction, which can promote them to continue sucking. Remember, babies usually need to suck about 1 to 2 minutes until you have that really nice letdown where your milk is actually coming out into them and they get the constant reward. So the first 1 to 2 minutes can take a little bit of time, and they might go on and off for a little bit to get a deep latch and wait for the letdown to happen. When you're bottle feeding your baby, it's very important to do a paced bottle feed. You want to aim for babies to take at least 10 minutes to finish a bottle and maybe even 15 to 20 minutes. However, you don't want to drag out the paced bottle feed for it to take over 30 or 40 minutes every single time. There are some really good paced bottle feeding videos on YouTube, so feel free to have a look. Just remember that when you're bottle feeding, you can give baby 1 or 2 breaks to let them burp or take a rest to slow down the feed. But other times, you want to keep the teat in their mouth the whole time. You also want to make sure that when you're doing a bottle feed, baby's lips are rolled out nice and evenly around the back of the teat. Another thing you can do when you're bottle feeding is that you want to hold baby in the position of how you would breastfeed them, close to your chest when you're doing a bottle feed. If someone else is giving a bottle, that's okay, but see if you will get a chance to do a bottle feed once or twice a day and get your support person to mimic your breastfeeding hold when they're bottle feeding baby. Next, we're going to talk about positioning, because how your baby is held affects how comfortable they are. If I'm eating a meal or drinking, I wouldn't want to eat my meal like this the whole time, where my head is facing one way and my body is facing one way. If someone fed me water over here with a straw, I'll probably be like, all right, one sip is enough because I'm not comfortable. So if your baby is having trouble latching and maintaining their latch on the breast, it's very important for you to make sure that your baby is positioning a way where their head, shoulder, and hip are facing the same direction, and that they have a clear airway when they're trying to latch and start drinking. I have a video on 6 ways to hold your baby with all the tips about micro adjustments with your baby's positioning to optimize their comfort. If your baby latches once or twice a day, but not other times of the day, it's probably either something to do with their positioning, where you are, how they're placed during those 1 to 2 feeds, or it's something to do with their behavior at the time of the feed. So pay more attention to these details, and hopefully we can figure out how to make your baby breastfeed more often. What's enough feeding? When your baby is just learning to start breastfeeding, we just want them to latch and suck instead of coming on and off the breast. You want them to latch and they can take breaks. You want them to sustain their latch for about 5 minutes. That's a great start. But if they can sustain their latch for 10 minutes or longer, that's even better. You want to offer both breasts. So if your baby falls asleep after 10 minutes, you can take baby off and swap to the other side. If your baby still seems hungry after that breastfeed, you can either go back and feed left and right again, or you can express what your baby didn't drink out and give it to them as a top-up. Now, let's put everything we've learned together. There are usually 2 different methods that I recommend depending on what situation you're going through and how you're feeling about transitioning back to breastfeeding. Option 1, you can either try to breastfeed for 5 to 10 minutes each side every time your baby is showing feeding cues or when you're about to do a bottle feed. Just remember, you're going to either give the bottle before or after or during a feed based on baby's cues and feeding behavior at the time. If your baby starts crying after 5 minutes on one side, that's okay. You're going to calm baby down with a little bit of taste of the bottle and then swap sides. Option 2, if trying to breastfeed every feed is too much for you, you can choose to attempt baby on the breast maybe just once or twice per day, but you're going to persist for a little bit longer. Remember, everything we just discussed, we're going to soothe the baby if they're screaming, wake the baby if they're asleep, and we're going to pick the best time to try to feed your baby, which is when they're interested and not crying. If this is all too much for you and your nipples are in a lot of pain to the point that breastfeeding is so scary, you can still bond with your baby by doing skin to skin with your baby and let your baby just smell and put their hand on your breast. This is going to help you keep baby close, and the smell and the touch will help them understand, okay, this is where my food is coming from. If your baby is showing signs that they're rejecting the breast and they don't like being around your breast, this is when we need to take a step back and respect the cues that your baby is telling you. You can try doing skin to skin or what we call baby wearing for a whole day, where you just try to stay in a nice relaxing space, probably your bedroom, and you're going to lay in bed and just do full skin to skin for a whole day. Put a wrap on top of your baby so that we don't get cold. And you're going to lay in bed and stay close with your baby with no expectations for them to feed. If your baby somehow makes their way down to the breast and wants to latch and have a go, feel free, but we're not going to push anything. If you're bottle feeding baby, continue bottle feeding baby and just keep holding baby between feeds. Be patient. This is a new experience for them, and breastfeeding is different to bottle feeding. Just like what I said before, this is like riding a bike, and you need to try multiple attempts, and sometimes it works, sometimes it doesn't work. Just because a baby is not learning to latch on one side doesn't mean they're not going to latch on the other side. And just because they don't want to latch at this time of the day doesn't mean they don't want to latch other times of the day. So keep trying different things. And if it doesn't work, don't be defeated straight away. It is a learning process. If your baby can latch just once a day, that's amazing and a great start, because you know that your breast and your baby's mouth works together and that this whole thing is possible. Thank you so much for watching this video. I hope I gave you some practical tips to help you establish your baby back to breastfeeding. And remember to always look after yourself during this precious journey. All the best and good luck. Bye.